Where are you from?
Tulsa, Oklahoma. I've been having neck and shoulder pain for years. Been to different pain doctor, physical therapy
Yeah.
to alleviate the pain, but nothing seems to work. And I was researching TMJ and found you online.
Yeah.
And so I'm here.
Yeah, right. How long has it been going on? For years?
For years.
5, 10?
My family told me that I collect my teeth as far back as high school, so it's.
Long time.
But over the years, it's been progressively worse.
Getting worse.
Yeah.
Where's the pain happen? Can you point to it?
It's back of my neck, shoulder, headache, and it also come down to my elbow.
Just on one side.
One side, yeah. I'm right-handed.
How about the headaches? Are they unilateral, one-sided, or bilateral?
Usually it's up front, sometimes on the left.
So, front or left? It's not usually right.
Right.
Okay. You have a missing tooth on your
Mhm.
upper, and
I didn't know that until yesterday.
yeah, I'm surprised. They didn't look real hard. There's asymmetry there.
Yeah.
That's the one thing that's sketchy about this. Can you drink cold stuff?
Tend not to,
Because
the sensitivity, and I'm a cold nature person. I prefer room temperature or warm.
so you won't drink like ice water or iced tea.
Unless go to the restaurant. Sometimes, most of the time, I even order without ice.
Yeah, gum. Can you chew gum?
I do chew gum.
And you have no problem?
In the recent month, I tend to not chew to the back of the molars because they hurt.
It hurts
So
to just
right.
chew on them?
Mhm.
What about when you clench? Is that a problem or not?
It just, the muscle here is really tight, but other than
Yeah.
that, the teeth are okay.
Do you think you grind your teeth at night?
I clench, don't grind.
Yeah.
And clacking also.
At the, are you ever tired, like in the cheek muscles?
Yes. Hmm.
How about the temples?
No, not the temple.
Just the cheek muscles. Do you ever have any kind of pain around your ear?
Sometimes, yeah.
Both sides or one side?
I guess sometimes both sides.
Yeah.
Hmm.
Okay.
I can hear the clicking.
Yeah, audibly, you can hear your own
Right.
jaw clicking on both sides?
I think so.
Yeah. When you wake up in the morning,
Mhm.
does it feel like, your cheek muscles are sore?
Yes.
Is that the worst time, or is it at the end of the day?
It's in the morning.
More in the morning?
Yeah. Hmm.
So it's highly likely that you clench at night?
Right. Hmm. Very
More so.
possible. I think I
Yeah.
know that for a fact.
Excuse me, have you ever noticed sticking your tongue between your front teeth?
No, not that.
Okay, thrusting your tongue, like tongue thrust. Is that
I don't think. Yeah.
not to
no.
your knowledge? Okay.
Don't do it.
Have you ever seen another dentist for this?
No.
So we're the first to try to address.
Yes.
Didn't you mention that, was it a physical therapist who thought that you had a TMD
The pain
issue?
specialist.
The pain, it was an MD?
Yes.
And what was his suggestion? What did he say exactly?
He said that I should seek TMJ help.
Because he did the best he could with what he had.
Right. Because my neck and shoulder is still, if I don't do the exercise, they're just painful.
What kind of exercises did they have you doing?
It's doing this and sideways.
Okay. Do you have trouble bending?
Yeah, I do. In fact, the therapy, I think I went through it for about a month, and from the first time he saw me till the end of the physical therapy session,
Right.
I gained quite a bit of movement.
Oh, you did? So
Yes.
that did help you some?
That did help, but it's a constant thing. I have to keep doing the exercise.
I see. Do you take any medication for any of this?
I was prescribed with muscle relaxer,
Did the muscle relaxer help?
anti-inflammatory. It knocks me out, so.
Yeah,
But it still doesn't help me from not clenching my teeth.
got it. Your pain?
Mm-hmm.
Seriously, since when you walked in to now, describe if you would.
Yeah, they're gone.
Yeah,
My facial pain
it's gone.
is gone.
And your neck is looser,
Yes.
and you can bend and you can twist.
Right.
The face, can you describe what it feels like?
I don't feel pain at all. on my face here, it was hurting a lot.
Even when you walked in?
Right.
Last night, yesterday,
Yeah.
last week?
Last week.
Last month?
Mhm.
Have you ever had a resolution like this since you went to the pain therapist or any of them?
No, not at all.
What kind of experience did you have when you walked out of their offices? It felt better?
After the therapy, like 2 week session that I did, the neck is better, but it didn't do anything to my face.
The face was just the
Right,
same?
just the same.
But the neck was a little bit looser?
Yes.
But now today, your neck is looser and your face is
Face
looser?
is looser, yeah.
So there's no pain?
No pain.
Okay. I'd love to have you back, whenever you can come.
Okay.
And we'll see how you're doing over time
All right.
and track that.
Mhm.
Easy.
Wow.
Hate it when that happens, don't you?
Yeah.
This is muscle. This is, if you've seen enough of the videos, you saw me talk about it.
Mm-hmm.
Electromyography, it just looks at these two muscles, the temporalis and the masters, which are the main ones we usually look at, okay?
Okay.
This guy's really hyperactive. He shouldn't be that way. You ever take biochemistry or biology?
Yeah, long time ago.
Yeah, right? But remember aerobic metabolism?
Uh-huh.
You create ATP,
Right,
energy,
yeah.
for the cells, right?
Mhm.
You spew out CO2.
Mhm.
We breathe off CO2. That's a very clean, green way of making energy.
Yeah.
When the muscles or the body needs more energy for some process, let's say muscle,
Mhm.
then it can make aerobically, it kicks on anaerobic. Anaerobic, we spewed out lactic acid. It's a very sloppy way of making energy,
Mhm.
a very archaic, evolutionarily speaking way.
Mhm.
And lactic acid is why, like when you work out really hard, you'll feel really sore.
Right.
But imagine if you never stopped working that muscle,
Yeah.
non-stop,
It's sore all the time.
all the time. So bam,
Uh-huh.
you see? So this guy is asking for so much energy all the time
Yeah.
that he is chronically sore.
Mhm.
Makes sense, right?
Right.
And I think you told me it was more your left side where you tended to have the headaches,
Right.
right?
Yeah, and like yesterday when we were doing this, and I got spasm over here.
On the left side.
Right. Not on the right side.
On the right side?
No, not on the right. On the left.
When you try to go sideways.
Right, yeah. Mhm.
Because it's frozen up.
Right.
It's ischemic. So aerobic pathways, you need oxygen, right?
Mhm.
Ischemia means lack of oxygen. So why would the muscle be parched like a desert of oxygen? Because it's all been used up to create the extra energy.
Yeah.
And then it kicks into the anaerobic and needs lactic and spits out lactic as a byproduct, right? So think about what I just said. So why does a muscle spasm? Because
It's overworked.
it's overworked and it's sucked up all the O2 and things are bound together. They're like ratcheting. Those fibers, they're locked together. So that makes sense, kind of, right? So the goal of DTR in a stable and adapted joint, which yours seem to be, we think so from what we can tell, through the bite, we can relax the muscles of mastication. So imagine when I'm done with you an hour from now, if that guy, now the EMG data won't necessarily show me at rest and this kind of a test that it's better. It takes time because it's still
Right.
looking for O2.
Yeah.
But you come back a few days or a week or two later, when we do this, it should be green
Mhm.
like the rest of them because it's had time to clear all that extra stuff. It's like all of a sudden it rains on the desert, the water being O2, and it can do its thing.
Right.
The shortest distance between 2 points is this, from
Right.
here to here.
Line.
Well, if A to B, you got to go down here.
Mhm. And then up.
I don't care how fast it is, doesn't that take more energy?
Right. It does.
Right?
Mhm.
When I push up here and palpate, does that feel tender?
Mhm.
Is this tender?
Yeah. Little
A
tiny.
little bit. How about back here?
Not
Not as bad as this
as
side.
this side. Yeah.
Right. A to B in a specified amount of time in a direct way.
Mhm.
There's a difference. This stuff is called a mid-course correction. At least that's what I call it.
Okay.
So neurologically, you have to do all these on the microsecond level,
Mhm.
make all these corrections, and the muscle has to fire extra to get over these teeth and humps and stuff stopping, right?
Okay.
kind of like you got a road, and you want the road to be smooth
Right.
and direct, so you can get there fast without tearing up your vehicle. To the left and open. So, you know, if this doesn't work, what's really happened? He ground about 30 microns of my enamel off on 2 or 3 teeth, and he bonded a couple of my eye teeth. They look better, and that didn't help.
Right.
That's the worst thing that happens here. Okay?
Okay.
All right. Bite down for me.
Almost normal.
Normal?
Almost normal.
We've done almost nothing, you know. Yeah.
Wow.
What's he like? That muscle?
Fine.
No big deal?
No big deal.
10 minutes ago he bothered you though, didn't he?
Right.
What's he like?
No, I can't feel anything at all.
They're both pretty
Wow.
normal now, aren't they?
Mhm.
Yeah. Down really hard to the left and open. Remember masseters?
Mhm.
Remember the green guys?
Right.
A little while ago? Remember they were in this 50,
Right.
60, 80 range?
Yeah.
Look at them now.
Man.
See that?
Yes. Much more normal.
Yeah. Bite them really hard to the right and open. Relax. What's it like?
Nothing.
Nothing?
Mhm.
And half an hour ago that was painful.
Right.
What's it like back here?
Nothing.
Nothing?
Mhm.
And half an hour ago, what was that like?
It was painful over there for sure.
What's it like, Sway?
Nothing.
Nothing?
Mhm.
What's this like?
Nothing.
Nothing? What's your face feel like now?
It's a little tight on the right hand side.
Still a little bit?
It's a little bit.
How about the left?
I can't feel anything.
Okay, move your neck around for me. Anything different?
Yeah, it's more relaxed.
Good.
It doesn't hurt bad.
On the left side?
Yeah.
Or is the right side still a little bit wound up though, right?
Mhm.
Yeah,
A little
yeah,
bit.
we're almost done with it.
Okay.
The right side we still have to finish.
At least my jaw, when I used to open, they were fatigued, hurt, but not bad anymore.
What, the popping?
When I open,
Yeah.
because they sore the muscle.
The muscles were?
Yeah.
Now you don't feel that?
Just a little bit on the right, but you're not done with the right side.
Not
so.
quite, yeah. So that's different just since this morning, right?
Yes.
And that was
For
something you've
sure.
always dealt with?
Yes, sir.
Wow, okay, good. So, when you bite down, it feels different than this morning?
Yes.
Right?
Mm-hmm.
Okay. No big deal?
No big deal.
No big deal? The difference between just using this and then
Mhm.
using the muscle?
Mm-hmm.
See, this gives us time and force,
Right.
but it doesn't give us muscle.
Mm-hmm.
So when I have muscle, I know that I've affected the change
Right.
that's causing your pain.
Pain. Mm-hmm.
The force and time thing doesn't necessarily cause your pain,
Okay.
but the muscle causes
Also
your
cause
pain.
Yeah.
But if I can control the bite and prove it with
Breathe
the
it.
muscle,
Muscle, you're right.
the pain goes away,
Right.
right?
Mm-hmm.
So just finding a T-scan person would get you nowhere. Because when you first bit, your numbers looked great on the T-scan.
Okay.
But that little intestinal mid-course thing was there. They don't know how to fix that.
Right.
But the muscles were pissed off,
Yeah.
right? You
Mhm.
saw it yourself.
And
And
mad,
watch those
yeah.
numbers drop.
Right. Yeah, it went from 80s to 20s.
Yeah, right? This muscle, the
Mhm.
pterygoid muscle on your right,
Mm-hmm.
it's what moves you left.
Okay.
Is the pain like here, or is it more around the
More
ear?
Around ear.
Yeah,
Right.
ear is the pterygoid,
Okay.
which would be responsible to help you protrude
Mm-hmm.
and move to your left.
Left.
Okay, open and close a few times. Move, jiggle around, just kind of move around, and move your neck too.
And my neck is like really
Loose?
loose now.
Like you had a good massage maybe, right?
Yes.
Yeah.
Mhm.
How's the face?
Yeah. Here it's better than just a little bit ago. Now it's probably 10%.
10% left.
Yeah.
So 90% better?
Yes. 100% better.
100%, 90%. Okay. Let's see if we can get it to 100. We'll try. Home to the right. Bend them really hard to the right. Nope.
Yeah, I don't feel that anymore.
Is it gone?
Uh-huh.
So the right side?
Mm-hmm.
Move your neck around. Are you loose?
Yes, sir.
Are you liking it?
Yes, sir. Wow. What an experience.
I know, right?
Yes.
So what do you think? What's your advice to other people?
Come talk to you.
All right.